I am Jordan, and
I am Jamie Coppinger.
what do you do?
I am a nurse in Flemington at Huntington Medical Center. I primarily work anywhere in the hospital. I call every morning and they tell me where to go. So that means I work in the emergency room, pediatrics floor. I work with the older population. I work with oncology patients. I work with respiratory patients. I do obstetrics. So I do a multitude of everything. But primarily, for the first 8 years of being a nurse, I worked with the older population and did mainly respiratory patients and oncology.
How long have you been doing this?
Almost 9 years.
Okay. How would you treat a basic fever to help a person get better faster?
Okay. So I take care of people who come to a hospital. And when they come to a hospital, if somebody has a fever, we automatically do blood work. And what we do for a fever is just your basic blood work, which is your red blood cells, your white blood cells, and your electrolytes, which are like sodium, potassium, calcium, things like that. But on top of that, for a fever, you need to do blood cultures. And blood cultures are representing bacteria in your bloodstream. They want to make sure that the blood that flows everywhere to all of your organs is not infected. Once we do that lab work, we can treat a person with an antibiotic, but not until after that lab work is done, because the antibiotic could already start to work before we get the lab work to know what the bacteria is.
Okay. How about like just a cold? Like, how would you treat somebody at home with like a cold?
You're just going to treat somebody by their symptoms, and a cold just runs its course. So everybody's different, and you have to kind of find what works for you. So, you know, for me, I am a big Advil person and NyQuil, but everybody's different. So some things work for some people and some things work for others. So that's just mostly by trial and error.
How about like something bigger, like the flu?
Okay, the flu. So right now is winter, big flu season. We have a lot of patients that are coming into the hospital with the flu. So to have the true flu and know if you do, one, you have to have a culture. And to be cultured, to know if you have the flu, it's a nasal swab. And we send that off to the lab, and that either comes back positive or not. But again, the flu is viral, and it's treated mainly by symptoms. It has to run its course, and everybody is different. There is a pill that people take. It's called Tamiflu, and it does help some, but mostly for the flu, it's time.
Okay. And do you know anything about the check, call, and care system?
We don't have a check call care system at our hospital, but we have what is a rapid response system, and that is hospital-wide. So every employee knows about the rapid response system, and as patients come to the hospital and they get oriented to their room, they learn about the rapid response system. We teach them what to do, and what the rapid response system is if I, as a nurse or anybody else, sees something going on and I need immediate care there fast, I can pick up a phone and dial 444, and that overhead pages throughout the hospital, and a team of people come. It's not just for the people who work there, it's for the people who are family members of the patients. It's for the patients. We teach everybody. So if they see an emergency situation, they can either yell rapid response or pick up a phone and dial 444. They can pick up the phone and press 0 for the operator. We in our hospital do not overhead page for anything unless it's an emergency. So we use beepers to contact people unless it's emergency. Emergency is overhead, so you get people there fast. And when I say fast, people are there in an instant. Everybody.
Okay. And have you ever had to handle an urgent situation with kids with asthma attacks or like allergic reactions?
Okay, so I'm newer to the emergency room, and in the emergency room, you see everybody. So asthma attacks for children, I have had a little experience, and depending on the age of a child, mostly it's treated by inhalers or respiratory treatments. And we use a face mask, and it's like a vaporized medication, and they just breathe it in. And depending on how severe it is, depends on how many treatments they get. And that could be another situation where time, and we just watch to wait to see how they react to getting the treatment. Are they doing well? Are they not doing well? Do they need to be admitted and be observed overnight? So that's really that for children. I did have one patient come in to the emergency room, and it was an adult. She was taking a medication and had never taken it before and had an allergic reaction to it. And there's a basic protocol that the nurses and the doctors follow, and it's about 5 different medications that the patient gets immediately, and it's standard. It's not on the patient's weight or, you know, their only thing that matters is allergies, whatever they are allergic to. But the medications that we use for that are pretty safe, and it's pretty universal.
And that's it.
Okay.
Hi, I am Jordan, and I will be interviewing Steve Feller today. What do you do?
I'm a carpenter by trade. That's how I make my money, but I'm also a member of the Chester Volunteer Fire Company. I was the chief in 2008 and 2009.
Okay. How long have you been doing that?
I joined the fire company in 1990. So 23 years off and on.
Okay. How would a normal person help somebody that's injured from, in any incident?
Is a firefighter will assist the first aid squad with the injuries, like a car accident or something like that. We'll also help get the person out of a car if they're trapped in the car, and make sure that everything is safe in the area.
Okay, and what did you do for training?
I went to the Morris County Police and Firefighter Training Academy, and when I took the training, it was probably a little over 100 hours. Now I know the training is about 150 to 180 hours, so it's a lot more, but it was over 20 years ago that I took the training. But there's always training ongoing too, to keep it up.
And what did you do during that training?
During the training, a lot of it was classroom training to learn how to deal with fire and everything, and then after the classroom training, it was followed up with in their burn building there with some practical experience.
Okay, and that is it.
Thank you.